Example of ACT. An adult dealing with anxiety learns to accept their anxious feelings rather than trying to eliminate them. They identify their value of being present with family and commit to spending quality time with them, even when anxiety is present. Conclusion. Third wave cognitive behavioral therapy represents a shift toward incorporating mindfulness, acceptance, and personal values into the therapeutic process. Approaches like dialectical behavior therapy, motivational interviewing, and acceptance and commitment therapy offer individuals new tools for managing their thoughts and emotions. By focusing on acceptance and aligning actions with personal values, third wave CBT helps individuals lead more fulfilling and meaningful lives. Dialectical behavior therapy. Marcia M. Linehan. Definition. Dialectical behavior therapy is a type of psychotherapy created by Dr. Marcia M. Linehan. It is designed to help individuals, particularly those with intense emotions and challenges like borderline personality disorder, learn skills to manage their emotions, build better relationships, and improve their overall quality of life. Key concepts. 1. Dialectics. The term dialectical comes from the idea of balancing opposites. In DBT, this means finding a balance between accepting oneself as they are and striving for change. It encourages individuals to accept their feelings and experiences while also working toward personal growth. 2. Emotional regulation. DBT teaches skills to help individuals understand and manage their emotions. This involves recognizing intense feelings, learning how to respond to them in healthy ways, and reducing emotional suffering. 3. Mindfulness. Mindfulness is the practice of being present in the moment and aware of one's thoughts and feelings without judgment. In DBT, mindfulness helps individuals observe their emotions and thoughts without becoming overwhelmed by them. 4. Interpersonal effectiveness. This refers to the skills needed to communicate effectively and maintain healthy relationships. DBT teaches individuals how to express their needs, say no when necessary, and resolve conflicts in a constructive manner. 5. Distress tolerance. Distress tolerance skills are strategies to help individuals cope with difficult emotions and situations without resorting to harmful behaviors. This includes techniques for managing crises and tolerating pain in a healthy way. Important details. Target population. DBT was originally developed for individuals with borderline personality disorder, but it has since been adapted for various mental health issues, including depression, anxiety, eating disorders, and substance abuse. Structure of DBT. DBT typically involves both individual therapy sessions and group skills training. In individual therapy, clients work on specific issues and apply skills to their daily lives. In group sessions, clients learn and practice DBT skills with support from others. 4 key skill areas. DBT focuses on teaching 4 main skill areas. 1. Mindfulness, being aware of thoughts and feelings in the present moment. 2. Emotional regulation, managing and understanding intense emotions. 3. Distress tolerance, coping with crisis situations without harmful behaviors. 4. Interpersonal effectiveness, communicating needs and maintaining relationships. Examples. Example of emotional regulation. A person feeling overwhelmed by anger learns to identify their triggers and use deep breathing techniques to calm down before reacting. They practice recognizing when their emotions are escalating and apply skills to manage their feelings in a constructive way. Example of mindfulness. During a mindfulness exercise, a client focuses on their breath, noticing how it feels to inhale and exhale. This practice helps them become more aware of their thoughts and feelings without getting caught up in them, making it easier to manage anxiety later on. Example of interpersonal effectiveness. A client learns to express their needs to a friend without being aggressive or passive. They practice using I statements, such as, "I feel upset when you cancel plans," and "I would appreciate it if you could let me know in advance," which helps them communicate effectively and strengthen their relationship. Conclusion. Dialectical behavior therapy, developed by Dr. Marcia M. Linehan, is a valuable therapeutic approach that helps individuals manage intense emotions and improve their relationships. By incorporating principles of dialectics, mindfulness, emotional regulation, distress tolerance, and interpersonal effectiveness, DBT empowers people to lead more balanced and fulfilling lives. Through learning and practicing these skills, individuals can better cope with challenges, enhance their emotional well-being, and develop healthier relationships. Skills training in dialectical behavior therapy. Definition: skills training in dialectical behavior therapy involves teaching individuals specific skills to help them manage their emotions, improve their relationships, and cope with stress. This training is usually conducted in a group setting where participants learn and practice these skills together. Key concepts. 1. Purpose of skills training. The main goal of skills training in DBT is to equip individuals with practical tools to handle difficult situations and emotions. By learning these skills, individuals can reduce emotional suffering and improve their overall quality of life. 2. For main skill categories. DBT focuses on 4 key areas of skills training. 1. Mindfulness, being fully present and aware of one's thoughts, feelings, and surroundings without judgment. Mindfulness helps individuals observe their emotions and experiences rather than getting overwhelmed by them. 2. Emotional regulation, learning to understand and manage intense emotions. This includes recognizing triggers, identifying emotions, and using strategies to change or cope with these feelings effectively. 3. Distress tolerance, developing skills to tolerate difficult situations and emotions without resorting to harmful behaviors. This involves learning to cope with crises and finding healthy ways to distract oneself during tough times. 4. Interpersonal effectiveness, improving communication and relationship skills. This includes learning how to express needs, set boundaries, and maintain healthy relationships while being assertive and respectful. Important details. Structure of skills training. Skills training is typically conducted in a group format, with a trained therapist leading the sessions. Each session focuses on a specific skill area, combining teaching, discussion, and practice. Participants often engage in role-playing and exercises to reinforce their learning. Practice and homework. After each session, individuals are encouraged to practice the skills they learned in their daily lives. They may be assigned homework to apply these skills in real-world situations and then discuss their experiences in the next session. Integration with individual therapy. Skills training complements individual therapy sessions. While skills training focuses on learning specific techniques, individual therapy allows clients to explore personal challenges and apply the skills to their unique situations. Examples. Mindfulness practice. During a mindfulness session, participants might practice focusing on their breath. They learn to notice when their mind wanders and gently bring their attention back to their breathing. This helps them become more aware of their thoughts and feelings without judgment. Emotional regulation exercise. A participant identifies a situation that triggered intense anger. They learn to use a technique called checking the facts, where they assess whether their emotional response matches the reality of the situation. This helps them realize that their anger may be exaggerated and allows them to respond more calmly. Distress tolérance technique. Participants learn a skill called radical acceptance, which involves accepting things as they are rather than fighting against them. For example, if someone is experiencing a breakup, they practice acknowledging their pain without trying to change the situation immediately, allowing themselves to process the emotions. Interpersonal effectiveness role play. In a group session, participants practice assertively expressing their needs. One person role plays, asking a friend to respect their boundaries when it comes to personal space. They practice using I statements like, "I feel overwhelmed when there's too much noise, and I need some quiet time," which helps them communicate effectively without being confrontational. Conclusion. Skills training in dialectical behavior therapy is a crucial component that helps individuals learn practical skills to manage their emotions, improve relationships, and cope with stress. By focusing on mindfulness, emotional regulation, distress tolerance, and interpersonal effectiveness, DBT empowers individuals to lead more balanced and fulfilling lives. The group setting, combined with practice and real-life application, enhances the learning experience and fosters personal growth. Phone counseling in dialectical behavior therapy. Definition. Phone counseling in dialectical behavior therapy refers to the practice of providing support and guidance to clients through phone calls between scheduled therapy sessions. This approach is designed to help clients apply the skills they are learning in real-life situations and to provide immediate support during moments of crisis. Key concepts. 1. Immediate support. One of the main purposes of phone counseling is to give clients access to support when they need it most. This can be especially helpful during times of emotional distress or when they're facing challenging situations where they might feel overwhelmed. 2. Skill application. Phone counseling allows clients to practice the skills they are learning in DBT outside of the therapy sessions. When faced with a difficult situation, clients can call their therapist for guidance on how to use these skills effectively. 3. Crisis management. Phone counseling is particularly beneficial for clients who may struggle with intense emotions or behaviors that could lead to self-harm or other harmful actions. Therapists can help clients navigate these crises and find healthier coping strategies in the moment. Important details. Boundaries and availability. In DBT, therapists typically set clear boundaries regarding when and how phone counseling can be used. For example, they might specify that clients can call during certain hours or for specific types of issues. This helps ensure that the service is used effectively and does not become overwhelming for the therapist. Focus on skills. During phone counseling sessions, therapists often focus on helping clients apply specific DBT skills. For example, if a client is feeling anxious, the therapist might guide them through mindfulness exercises over the phone or help them use distress-tolerant skills to cope with their feelings. Documentation. Therapists may keep a record of phone counseling calls to track the client's progress and identify patterns in their emotional responses. This information can be useful in future therapy sessions to discuss what worked well and what could be improved. Examples. Example 1. Handling a crisis. A client feels overwhelmed after an argument with a friend and is at risk of engaging in self-harming behavior. They call their therapist for immediate support. The therapist helps the client use distress-tolerant skills, such as deep breathing and grounding techniques, to calm down and manage their feelings. Example 2. Applying skills. A client is preparing for a stressful job interview and feels anxious about it. They call their therapist to discuss their worries. The therapist helps the client practice mindfulness techniques over the phone, guiding them to focus on their breathing and visualize a successful interview. This helps the client feel more confident and better prepared. Example 3. Communication issues. A client has a difficult conversation plan with a family member. They call their therapist to discuss how to express their feelings assertively. The therapist helps the client role-play the conversation, using interpersonal effectiveness skills to communicate their needs clearly and respectfully. Conclusion. Phone counseling and dialectical behavior therapy is an important tool that provides clients with immediate support and guidance during challenging situations. By offering a way to apply DBT skills in real time, phone counseling helps individuals manage their emotions, navigate crises, and improve their overall mental health. The structured approach, combined with a focus on skill application, empowers clients to make healthier choices and enhances their therapeutic experience. Therapist consultation team in dialectical behavior therapy. Definition. A therapist consultation team in dialectical behavior therapy is a group of therapists who come together to support each other while providing DBT to their clients. This team meets regularly to discuss cases, share experiences, and ensure that they are offering the best possible care to their clients. Key concepts. 1. Support for therapists. The main goal of the consultation team is to provide emotional and professional support to therapists. Working with clients who have intense emotions and complex issues can be challenging, so having a team allows therapists to share their feelings and seek advice. 2. Improving treatment quality. By discussing cases with peers, therapists can gain new insights and ideas about how to help their clients. This collaboration enhances their skills and knowledge, leading to better treatment outcomes for clients. 3. Accountability. The consultation team helps therapists stay accountable to the principles of DBT. Members encourage each other to stick to the DBT methods and ensure they're using the skills and techniques correctly. 4. Problem solving. Therapists can bring specific cases or challenges they're facing to the group. The team can brainstorm solutions, share successful strategies, and provide feedback. This collaborative problem-solving helps therapists overcome obstacles in their work. Important details. Structure of meetings. Consultation team meetings typically occur weekly or bi-weekly, depending on the needs of the therapists. During these meetings, therapists might discuss specific clients, share experiences, and review DBT techniques to ensure they are being used effectively. Focus on self-care. In addition to discussing cases, the team often emphasizes the importance of self-care for therapists. Working in mental health can be emotionally taxing, so the team encourages members to take care of their own mental well-being to prevent burnout. Training and development. The consultation team may also include training sessions where therapists can learn new skills or refresh their knowledge of DBT principles. This ongoing education helps keep their practice up-to-date and effective. Examples. Example 1. Case discussion. A therapist may share a challenging case involving a client who is struggling with self-harm. The team discusses different approaches that have worked for them in similar situations, allowing the therapist to gain new ideas for helping their client. Example 2. Emotional support. A therapist feels overwhelmed after a particularly intense session with a client. They bring this feeling to the consultation team, where other members provide support and share their own experiences. This helps the therapist feel less isolated and more understood. Example 3. Accountability. If a therapist finds themselves drifting away from DBT techniques, they can bring this to the consultation team. The team can remind them of the importance of sticking to the DBT model and encourage them to refocus on the skills they need to use with clients. Conclusion. The therapist consultation team is a vital component of dialectical behavior therapy that supports therapists in their work. By providing a space for collaboration, accountability, and emotional support, the team helps ensure that therapists can deliver effective treatment to their clients. This structure not only improves the skills and knowledge of the therapist, but also enhances the overall quality of care provided to individuals seeking help. Individual treatment in dialectical behavior therapy. Definition: individual treatment in dialectical behavior therapy involves one-on-one sessions between a therapist and a client. This personalized approach aims to help clients understand and manage their emotions, develop coping skills, and improve their overall mental health. Key concepts. 1. Focus on the individual. Individual treatment is tailored to meet each client's specific needs and challenges. The therapist works closely with the client to understand their unique experiences, emotions, and behaviors. 2. Combining skills training. While individual therapy sessions focus on personal issues, the therapist also helps clients learn and apply the skills taught in DBT skills training. These skills include mindfulness, emotional regulation, distress tolerance, and interpersonal effectiveness. 3. Therapeutic relationship. A strong and supportive relationship between the therapist and client is essential in DBT. This relationship helps build trust, allowing clients to feel safe sharing their thoughts and feelings. 4. Goal setting. In individual treatment, the therapist and client work together to set specific goals for therapy. These goals can include reducing harmful behaviors, improving relationships, or managing intense emotions more effectively. Important details. Structure of sessions. Individual therapy sessions typically last about 50 minutes and occur weekly. During these sessions, the therapist and client discuss recent experiences, explore emotions, and practice skills relevant to the client's challenges. Crisis management. If a client is experiencing a crisis or intense emotional distress, individual sessions provide a space to address these issues immediately. The therapist can help the client use distress tolerance skills and develop a plan for managing the crisis. Homework assignments. Therapists often assign homework to clients, encouraging them to practice the skills learned during sessions in their daily lives. This helps reinforce learning and promotes the application of skills in real-world situations. Using dialectics. The concept of dialectics, which involves balancing acceptance and change, is central to individual treatment. Therapists help clients accept their current situation while also working towards positive changes in their behavior and mindset. Examples. Example 1. Managing emotional intensity. A client who struggles with anger might work with their therapist to identify triggers for their anger and practice using emotional regulation skills. They might role-play scenarios during sessions to practice responding calmly instead of reacting with anger. Example 2. Improving relationships. A client who has difficulty communicating with friends can work with their therapist to develop interpersonal effectiveness skills. They might practice how to express their needs assertively and set boundaries in a safe, supportive environment. Example 3. Coping with a crisis. If a client experiences a significant life event, like a breakup, they can meet with their therapist to discuss their feelings and reactions. The therapist can guide the client in using distress tolerance techniques, such as self-soothing or distraction, to cope with the emotional pain. Conclusion. Individual treatment in dialectical behavior therapy provides personalized support for clients dealing with complex emotional challenges. Through a combination of skills training, crisis management, and goal setting, therapists help clients develop effective coping strategies and improve their overall well-being. The strong therapeutic relationship fosters trust and allows clients to explore their emotions in a safe space, ultimately leading to healthier behaviors and more fulfilling lives. DBT-informed practices in dialectical behavior therapy. Definition: DBT-informed practices refer to techniques and principles derived from dialectical behavior therapy that can be applied in various settings, even by professionals who may not be specifically trained as DBT therapists. These practices aim to help individuals manage their emotions, improve their relationships, and develop coping skills based on the foundational ideas of DBT. Key concepts. 1. Understanding DBT principles. DBT is built on the idea of balancing acceptance and change. It emphasizes the importance of accepting oneself and one's emotions while also working towards positive changes in thoughts and behaviors. DBT-informed practices incorporate this balance into everyday interactions. 2. Focus on skills. DBT-informed practices often include teaching and applying DBT skills, such as mindfulness, emotional regulation, distress tolerance, and interpersonal effectiveness. These skills can be useful in various settings, including schools, hospitals, and social services. 3. Flexibility in implementation. DBT-informed practices can be adapted to fit different contexts and populations. This flexibility allows professionals from various fields to incorporate DBT principles into their work, whether they're counselors, teachers, or healthcare providers. 4. Supportive environment. Creating a supportive and validating environment is essential in DBT-informed practices. This means actively listening to individuals, acknowledging their feelings, and helping them feel understood while encouraging them to work on their challenges. Important details. Training and awareness. While DBT-informed practices do not require full DBT training, it is beneficial for professionals to have a basic understanding of DBT principles and techniques. This knowledge allows them to effectively support individuals who may benefit from DBT skills. Application across settings. DBT-informed practices can be utilized in various environments, such as schools. Teachers can use DBT skills to help students manage anxiety and improve their social interactions. Healthcare. Medical staff can incorporate DBT-informed practices to support patients dealing with chronic illness or mental health challenges. Social services. Caseworkers can use DBT principles to help clients navigate difficult emotions and improve their coping strategies. Collaboration. Professionals using DBT-informed practices often collaborate with trained DBT therapists to ensure that individuals receive comprehensive care. This collaborative approach enhances the effectiveness of treatment. Examples. Example 1. Mindfulness in the classroom. A teacher notices that students are feeling anxious during exam periods. They introduce short mindfulness exercises, such as deep breathing or guided imagery, to help students calm their minds before tests. This practice helps reduce anxiety and improve focus. Example 2. Emotional regulation in healthcare. A nurse working with patients who experience pain or anxiety teaches them emotional regulation skills. For instance, the nurse might guide patients in recognizing their emotions and using coping strategies like distraction or relaxation techniques to manage discomfort. Example 3. Interpersonal skills in social services. A social worker helps clients improve their communication skills by teaching them how to express their needs assertively. They might role-play scenarios where clients practice saying no or asking for help in a respectful manner. This empowers clients to advocate for themselves in their relationships. Conclusion: DBT-informed practices are valuable techniques that apply the principles of dialectical behavior therapy in various settings. By focusing on skills like mindfulness, emotional regulation, and interpersonal effectiveness, professionals can support individuals in managing their emotions and improving their overall well-being. The flexibility and adaptability of DBT-informed practices make them effective tools for anyone looking to enhance their interactions and support those facing emotional challenges. William Miller and Stephen Rolnick in Motivational Interviewing. Definition: motivational interviewing is a counseling approach developed by William Miller and Stephen Rolnick. It is designed to help people find the motivation to change their behaviors, particularly in areas like addiction, health, and mental well-being. MI is focused on enhancing a person's intrinsic motivation to change by exploring and resolving their ambivalence. Key concepts: 1. Collaboration. MI emphasizes working together with the client rather than telling them what to do. The counselor acts as a partner, guiding the client through their thoughts and feelings about change. This collaborative approach builds trust and encourages open communication. 2. Evocation. Instead of providing solutions, MI seeks to draw out the client's own reasons for wanting change. This means helping clients articulate their personal motivations and values that can support their decision to make a change. 3. Autonomy. MI respects the client's right to make their own choices. The counselor supports the client's ability to decide whether and how to change, emphasizing that the decision is ultimately theirs. This fosters a sense of empowerment. 4. Ambivalence. Many clients experience mixed feelings about changing their behavior. MI acknowledges this ambivalence as a natural part of the process. The counselor helps clients explore their conflicting feelings and find clarity about their desires and goals. Important details: the spirit of MI. Miller and Rolnick describe the spirit of MI as being compassionate, respectful, and supportive. It involves partnership, building a trusting relationship with a client. Acceptance, recognizing the client's strengths and understanding their perspective. Compassion, caring about the client's well-being and wanting to help them succeed. Evocation, drawing out the client's own motivations and reasons for change. Core skills. MI uses specific skills to facilitate conversation and encourage change. Open-ended questions. These questions invite more than a yes or no answer and encourage clients to think deeply about their feelings. Affirmations. Compliments or positive statements that recognize the client's strengths and efforts. Reflective listening. Listening carefully and reflecting back what the client says to show understanding and validate their feelings. Summarizing. Recapping what the client has shared to ensure clarity and reinforce their motivations. Applications. MI is widely used in various fields, including addiction treatment, healthcare, and mental health counseling. It can help individuals who are struggling with substance abuse, chronic illness management, and behavior change. Examples. Example 1. Substance abuse treatment. A counselor meets with a client who is considering quitting smoking. Instead of telling the client they should quit, the counselor uses MI techniques to ask open-ended questions like, "What do you think will be the benefits of quitting smoking?" This encourages the client to explore their own reasons for change. Example 2. Health and wellness. A health coach works with a client who wants to lose weight but feels uncertain about making lifestyle changes. The coach uses reflective listening to acknowledge the client's fears and helps them identify small, manageable steps they can take toward their goals, such as cooking healthy meals or exercising for a few minutes each day. Example 3. Teen counseling. A school counselor helps a teenager who is struggling with academic performance. Instead of imposing strict rules, the counselor uses motivational interviewing to explore the teen's interests and goals, asking questions like, "What subjects do you enjoy, and how can we make school more engaging for you?" This empowers the teen to take ownership of their education. Conclusion. William Miller and Stephen Rolnick developed motivational interviewing as a compassionate and collaborative approach to help individuals find their motivation for change. By focusing on partnership, evocation, and respect for autonomy. MI encourages clients to explore their feelings and make informed decisions about their behavior. The skills and principles of MI are valuable tools for counselors and healthcare providers looking to support individuals in making positive life changes. OERS in motivational interviewing. Definition: OERS is an acronym that stands for Open Questions, Affirmations, Reflections, and Summaries. These are key skills used in motivational interviewing to help clients explore their thoughts and feelings, enhance their motivation to change, and build a strong therapeutic relationship. Key concepts. 1. Open questions. Open questions are questions that cannot be answered with a simple yes or no. They encourage clients to think more deeply and share their thoughts and feelings in detail. For example, instead of asking, "Do you want to change?" a therapist might ask, "What are some reasons you might want to change your behavior?" 2. Affirmations. Affirmations are positive statements that recognize and support a client's strengths, efforts, and achievements. These help build the client's confidence and reinforce their motivation. For instance, saying, "I admire how committed you are to improving your health," encourages the client and acknowledges their efforts. 3. Reflections. Reflections involve the therapist paraphrasing or restating what the client has said. This shows that the therapist is actively listening and helps clients feel understood. For example, if a client says, "I feel overwhelmed by my responsibilities," the therapist might reflect, "It sounds like you're feeling a lot of pressure from everything going on in your life." 4. Summaries. Summaries are concise recaps of what the client has said during a session. They help clarify and reinforce key points, making it easier for clients to see their progress and understand their feelings. For example, a therapist might summarize, "So far, we've talked about your desire to quit smoking, the challenges you face, and the strategies you're considering." Important details. Building rapport. Using OERS techniques helps build rapport between the therapist and client. When clients feel heard and understood, they are more likely to open up and engage in the process of change. Enhancing motivation. OERS encourages clients to explore their motivations and reasons for change. By using open questions, affirmations, reflections, and summaries, therapists can help clients articulate their desires and make connections between their feelings and behaviors. OERS techniques can be used flexibly throughout a conversation. Therapists may switch between these skills depending on the client's needs and the flow of the discussion. Examples. Example 1. Open questions. A client expresses doubt about their ability to stick to a new exercise routine. The therapist asks, "What are some things that might help you stay motivated to exercise?" This encourages the client to think about their personal strategies for motivation. Example 2. Affirmations. During a session, a client shares that they've started keeping a food journal. The therapist responds with, "That's a great step. Keeping track of your meals shows that you're taking your health seriously." This affirmation boosts the client's confidence. Example 3. Reflections. If a client says, "I'm really frustrated with my progress," the therapist might reflect, "It seems like you're feeling stuck and upset about not moving forward as quickly as you'd like." This helps validate the client's feelings and encourages further exploration. Example 4. Summaries. At the end of a session, the therapist summarizes by saying, "Today we talked about your goals for reducing stress, the challenges you face at work, and the coping strategies you want to try. It sounds like you have a good plan moving forward." This helps the client see the bigger picture and reinforces their commitment to change. Conclusion. OERS is a set of essential skills in motivational interviewing that helps therapists engage clients in meaningful conversations about change. By using these techniques, therapists can build rapport, enhance motivation, and support clients in exploring their thoughts and feelings. OERS fosters a collaborative environment where clients feel heard and empowered to make positive changes in their lives. Engaging, focusing, evoking, planning, and motivational interviewing. Definition. Engaging, focusing, evoking, and planning are the 4 key processes in motivational interviewing. These processes guide the conversation between the therapist and the client, helping to enhance the client's motivation to change their behavior. Each process plays a specific role in the overall MI approach. Key concepts. 1. Engaging. Engaging is the first step in MI, where the therapist builds a trusting and collaborative relationship with the client. This involves creating a safe space where the client feels comfortable expressing their thoughts and feelings. The therapist listens actively and shows empathy to establish rapport. 2. Focusing. Once a connection is established, the next step is focusing. This process involves narrowing down the conversation to specific topics or goals that the client wants to address. The therapist helps the client identify and clarify what they truly want to change. This focus provides direction for the conversation. 3. Evoking. Evoking is about drawing out the client's own motivations for change. The therapist guides the client to explore their reasons for wanting to change and any ambivalence they may have. This process encourages clients to articulate their desires, values, and goals, making them more likely to commit to change. 4. Planning. The final step is planning, where the therapist and client work together to develop a concrete plan for achieving the desired change. This involves setting specific, achievable goals and discussing the steps the client will take to reach those goals. The plan should feel realistic and aligned with the client's motivations. Important details. Client-centered approach. MI is a client-centered approach, meaning that it emphasizes the client's perspective and autonomy throughout the process. The therapist acts as a guide, supporting the client in their journey rather than directing it. Building trust. Engaging and focusing are crucial for building trust and understanding. When clients feel understood and respected, they are more likely to share their thoughts openly and consider making changes. Addressing ambivalence. During the evoking phase, therapists help clients confront their mixed feelings about change. This can involve discussing the pros and cons of their current behavior and the potential benefits of making a change. Creating a realistic plan. In the planning phase, it's important to create a plan that is not only specific but also flexible. This allows clients to adapt their strategies as needed and feel empowered to take ownership of their journey. Examples. Example 1. Engaging. A therapist meets with a client who feels anxious about their drinking habits. The therapist begins by asking open-ended questions about the client's feelings and experiences, actively listening to their concerns and showing empathy. This helps the client feel comfortable and understood. Example 2. Focusing. After establishing rapport, the therapist asks the client, "What specific changes would you like to make regarding your drinking?" The client expresses that they want to reduce their alcohol consumption. The therapist helps the client clarify their goals, focusing on this particular issue. Example 3. Evoking. The therapist asks the client, "What are some reasons you want to cut back on drinking?" The client shares that they want to improve their health and have better relationships. The therapist reflects back these motivations, helping the client feel more connected to their reasons for change. Example 4. Planning. Together, the therapist and client create a step-by-step plan for reducing alcohol intake. They discuss setting specific goals, such as limiting drinks to 2 per week, finding alternative activities, and identifying support systems. The therapist ensures that the plan feels manageable and aligns with the client's motivations. Conclusion. Engaging, focusing, evoking, and planning are essential processes in motivational interviewing that help therapists guide clients toward meaningful change. By building a trusting relationship, narrowing the conversation to specific goals, drawing out the client's motivations, and developing a realistic plan, MI empowers clients to take charge of their behavior and work toward their personal goals. This structured approach fosters a supportive environment that encourages self-discovery and commitment to change. Client-centered motivation in motivational interviewing. Definition. Client-centered motivation in motivational interviewing refers to the approach where the therapist focuses on understanding and supporting the client's own motivations for change. Instead of pushing the client to change based on external expectations or advice, the therapist helps the client explore their personal reasons for wanting to make change. This approach empowers clients to take ownership of their decisions and actions. Key concepts. 1. Empowerment. One of the main goals of client-centered motivation is to empower clients. This means helping them realize that they have the ability to make choices and take control of their lives. When clients feel empowered, they are more likely to commit to making positive changes. 2. Intrinsic motivation. Intrinsic motivation comes from within the individual. It refers to the personal reasons and desires that drive a person to change, such as wanting to improve health, relationships, or overall well-being. MI focuses on tapping into these intrinsic motivations rather than relying on external pressures. 3. Active listening. In client-centered MI, active listening is crucial. The therapist listens carefully to the client's thoughts, feelings, and concerns without judgment. This helps the client feel understood and valued, making it easier for them to express their motivations and ambivalence about change. 4. Exploring ambivalence. Many clients experience mixed feelings about making changes in their lives. In client-centered MI, therapists help clients explore this ambivalence. By discussing both the pros and cons of their current behavior and the potential benefits of change, clients can gain clarity about their motivations. Important details. Building rapport. A strong therapeutic relationship is essential in client-centered motivation. When clients trust their therapist, they are more likely to open up about their feelings and motivations. Building rapport involves showing empathy, respect, and understanding. Personal goals. Client-centered motivation emphasizes the importance of personal goals. The therapist encourages clients to identify what they truly want to achieve and supports them in setting realistic and meaningful goals that align with their values. Non-directive approach. In MI, the therapist takes a non-directive approach, meaning they do not tell clients what to do. Instead, they guide clients to discover their reasons for change and help them develop their own plans for achieving their goals. Examples. Example 1. Exploring reasons for change. A client who smokes may feel conflicted about quitting. The therapist asks, "What are some reasons you have for wanting to quit smoking?" The client reflects and shares that they want to improve their health for their children. This exploration helps the client connect their desire to change with their personal values. Example 2. Discussing ambivalence. A client is unsure about starting an exercise routine. The therapist might say, "It sounds like you see some benefits to exercising, but you also have concerns about fitting into your schedule. Can you tell me more about that?" This helps the client articulate their mixed feelings and consider their motivations for exercising. Example 3. Setting personal goals. A client expresses the desire to lose weight but feels overwhelmed. The therapist encourages them to identify specific goals, such as walking for 30 minutes 3 times a week. By focusing on achievable steps, the client feels empowered to take action. Conclusion. Client-centered motivation in motivational interviewing emphasizes the importance of understanding and supporting a client's personal motivations for change. By empowering clients, fostering intrinsic motivation, and exploring ambivalence, therapists can help individuals take ownership of their decisions and actions. This approach creates a supportive and collaborative environment where clients feel heard and valued, ultimately leading to more successful and meaningful changes in their lives. Ambivalence toward change in motivational interviewing. Definition. Ambivalence toward change refers to the mixed feelings or uncertainty a person may have about making a change in their behavior. In the context of motivational interviewing, understanding and addressing this ambivalence is crucial for helping clients move forward and make positive changes in their lives. Key concepts. 1. Understanding ambivalence. Ambivalence is a normal part of the change process. Many people experience conflicting feelings about whether to change a particular behavior. For example, someone might want to quit smoking but also enjoy the comfort and habit of smoking. Recognizing this conflict is essential for facilitating change. 2. Exploring reasons. MI encourages clients to explore both sides of their ambivalence. This means discussing the benefits of changing a behavior and the drawbacks of changing. This exploration helps clients clarify their thoughts and feelings. 3. Intrinsic motivation. Ambivalence often arises when clients have different motivations for change. MI focuses on helping clients identify their intrinsic motivations, those personal reasons that drive them to want to change. By understanding what truly matters to them, clients can feel more motivated to overcome ambivalence. 4. Supportive environment. A supportive and non-judgmental environment is crucial for addressing ambivalence. When clients feel safe and understood, they are more likely to express their conflicting feelings openly. This openness allows for deeper exploration and understanding of their motivations. Important details. Role of the therapist. In MI, the therapist plays a key role in helping clients navigate their ambivalence. Instead of pushing clients toward change, the therapist uses techniques like reflective listening and open-ended questions to guide clients in exploring their feelings and thoughts about change. Recognizing change talk. Change talk refers to any statements made by the client that express a desire, ability, or reason to change. For example, a client might say, "I really want to be healthier." Recognizing and reinforcing this change talk helps clients feel more confident about making changes. Addressing resistance. Sometimes, clients may resist change due to their ambivalence. In MI, therapists help clients understand this resistance as part of the process rather than seeing it as a barrier. By exploring the reasons behind the resistance, clients can work through their feelings and find a path forward. Examples. Example 1. A client who wants to lose weight. A client expresses a desire to lose weight, but also enjoys eating unhealthy foods. The therapist asks, "What do you like about your current eating habits? And what benefits do you think you would gain from losing weight?" This helps the client articulate their conflicting feelings and consider the impact of both sides. Example 2. Quitting smoking. A client wants to quit smoking but feels anxious about facing triggers. The therapist might say, "It sounds like you're worried about how you'll cope without smoking, but you also want to improve your health. Can we talk about what quitting smoking would mean for you?" This conversation allows the client to explore their ambivalence. Example 3. Changing exercise habits. A client knows they should exercise more, but feels tired after work and prefers to relax. The therapist might ask, "What benefits do you see from exercising and what challenges do you face in doing it?" This helps the client reflect on their motivations and obstacles, creating space for potential solutions. Conclusion. Ambivalence toward change is a common experience in the process of making behavioral changes. In motivational interviewing, understanding and addressing this ambivalence is crucial for helping clients clarify their motivations and navigate their conflicting feelings. By creating a supportive environment and exploring both sides of ambivalence, therapists empower clients to find their own reasons for change and move forward confidently. This approach ultimately enhances the likelihood of successful and lasting change in their behaviors. Acceptance and commitment therapy. Definition. Acceptance and commitment therapy is a type of psychotherapy developed by Stephen C. Hayes. It focuses on helping people accept their thoughts and feelings rather than trying to change or control them. The goal of ACT is to help individuals commit to actions that align with their values and lead to a meaningful life. Key concepts. 1. Acceptance. Acceptance involves being open to experiencing thoughts and feelings without judgment. Instead of fighting against negative emotions or trying to avoid them, ACT encourages clients to allow these feelings to exist without letting them dictate their actions. For example, someone feeling anxious might learn to accept their anxiety as a part of life rather than trying to eliminate it. 2. Cognitive diffusion. Cognitive diffusion is a technique used in ACT that helps individuals separate themselves from their thoughts. Instead of viewing thoughts as facts, clients learn to see them as just words or ideas. This can reduce the power that negative thoughts have over their emotions and behaviors. For example, instead of thinking, "I am a failure," a client might learn to say, "I am having the thought that I am a failure." 3. Mindfulness. Mindfulness is the practice of being present in the moment and fully aware of one's thoughts, feelings, and surroundings. In ACT, mindfulness techniques help clients observe their thoughts and feelings without judgment. This can lead to greater emotional awareness and help clients respond to situations more effectively. 4. Values clarification. ACT emphasizes the importance of understanding one's values, what truly matters to an individual. By identifying their values, clients can make decisions and set goals that align with what they find meaningful. For example, if a client values family, they might focus on actions that strengthen their relationships with loved ones. 5. Committed action. Committed action involves taking steps toward living in accordance with one's values. This means setting specific goals and taking actionable steps, even in the presence of difficult thoughts or feelings. For instance, someone who values health may commit to exercising regularly, even if they feel anxious about it. Important details. Psychological flexibility. A key goal of ACT is to develop psychological flexibility, which is the ability to adapt to challenging situations and respond in ways that align with one's values. This flexibility allows individuals to face life's difficulties without being overwhelmed by their emotions. Therapeutic relationship. The relationship between the therapist and the client is crucial in ACT. Therapists create a safe and supportive environment where clients feel comfortable exploring their thoughts and feelings. This trust helps clients engage in the acceptance and commitment processes more effectively. Application across issues. ACT can be applied to various psychological issues, including anxiety, depression, chronic pain, and stress. It helps individuals develop coping strategies that promote mental well-being, regardless of the challenges they face. Examples. Example 1. Dealing with anxiety. A client who struggles with anxiety may learn to accept that feeling anxious is a part of their experience. Instead of trying to eliminate anxiety, they practice mindfulness to observe their anxious thoughts without judgment. They might say to themselves, "I notice I am feeling anxious, and that's okay." Example 2. Overcoming fear of failure. A student who fears failing a test may use cognitive diffusion techniques. Instead of thinking, "I will fail this test," they practice saying, "I am having the thought that I will fail." This helps them recognize that their thoughts do not define their reality. They can then commit to studying and preparing for the test, focusing on their value of education. Example 3. Strengthening relationships. A client who values family might commit to spending quality time with their loved ones, even when they feel overwhelmed by work or personal issues. They set specific goals, such as scheduling weekly family dinners, to ensure they are living in alignment with their values. Conclusion. Acceptance and commitment therapy, developed by Stephen C. Hayes, is a powerful therapeutic approach that emphasizes acceptance, mindfulness, and commitment to values-based action. By helping individuals accept their thoughts and feelings, develop psychological flexibility, and take meaningful actions, ACT empowers clients to lead more fulfilling and purposeful lives. This approach is particularly useful for addressing various psychological challenges while promoting overall mental well-being. Psychotherapy of the absurd, Carl Whitaker. Definition: psychotherapy of the absurd is a unique approach to therapy developed by Carl Whitaker, an influential American psychiatrist. This approach focuses on the inherent absurdity of life and human existence, using humor and creativity to help clients confront their emotions and experiences. It encourages individuals to embrace the chaos of life, rather than trying to make sense of everything. Key concepts. 1. Absurdity of life. Whitaker believed that life is often irrational and full of contradictions. By recognizing the absurdity of human existence, individuals can gain a new perspective on their struggles. This approach encourages clients to see their problems in a different light, which can reduce anxiety and promote acceptance. 2. Authenticity and spontaneity. In therapy, Whitaker emphasized the importance of being genuine and spontaneous. He believed that therapists should be themselves and express their true feelings, rather than adhering to strict professional boundaries. This authenticity helps create a more open and honest therapeutic relationship. 3. Humor and playfulness. Humor plays a central role in the psychotherapy of the absurd. Whitaker used humor to help clients lighten their burdens and explore difficult emotions. By finding the funny or absurd aspects of their situations, clients can gain insight and develop a more flexible attitude toward their problems. 4. Embracing chaos. Instead of trying to impose order on their lives, clients are encouraged to embrace the chaos and unpredictability of existence. This acceptance can lead to greater resilience and a willingness to face challenges without being paralyzed by fear or anxiety. 5. Therapeutic relationship. Whitaker believed that the relationship between the therapist and client is crucial for successful therapy. By fostering a warm and supportive environment, Therapists can help clients feel safe enough to explore their thoughts and feelings, even when those feelings are uncomfortable or absurd. Important details. Family therapy focus. Whitaker often applied his ideas in the context of family therapy, where he encouraged families to express their emotions and dynamics openly. He believed that addressing the absurdity in family interactions could lead to healthier communication and relationships. Creative techniques. Whitaker utilized creative techniques such as role-playing, storytelling, and metaphor to help clients express their thoughts and emotions. These methods allow clients to explore their feelings in a less direct way, making it easier to confront difficult issues. Acceptance of imperfection. A key aspect of Whitaker's approach is accepting that life is imperfect and that people are not always rational. This acceptance can help clients release the pressure to be perfect and allow them to focus on growth and self-discovery. Examples. Example 1. Dealing with anxiety. A client struggling with anxiety might feel overwhelmed by the pressure to have everything figured out. In therapy, the therapist could use humor to illustrate the absurdity of trying to control every aspect of life. They might say, trying to control everything is like trying to catch smoke with your bare hands. This perspective can help the client relax and see that it's okay to let go. Example 2. Family dynamics. In a family therapy session, a family might engage in role-playing to explore their communication patterns. The therapist might encourage them to act out a typical family dinner, but with exaggerated absurdities, such as everyone speaking in rhymes. This playful approach can highlight the ridiculousness of their arguments, making it easier for family members to discuss their real issues. Example 3. Embracing life's chaos. A client who feels stuck in their career might be encouraged to embrace the uncertainty of their job situation. The therapist could ask, what if you treated this chaos as an adventure? What would you do differently? This prompts the client to think creatively about their options instead of feeling trapped. Conclusion. Psychotherapy of the absurd, developed by Carl Whitaker, is a distinctive approach that encourages individuals to embrace the absurdity of life. By using humor, authenticity, and creativity, therapists help clients confront their emotions and navigate the chaos of existence. This approach fosters a deeper understanding of oneself and promotes resilience, allowing clients to approach their problems with a new perspective and a lighter heart. Through this lens, clients can find meaning and growth amid the unpredictability of life. Transactional analysis, ego states. Definition. Transactional analysis, developed by Eric Berne, is a theory of personality and communication. It suggests that our personality is made up of 3 distinct ego states: parent, adult, and child, which represent different ways we think, feel, and behave. At any given moment, we are operating from one of these states, and our interactions with others are essentially exchanges between these states. The 3 ego states. 1. Parent ego state. This state consists of behaviors, thoughts, and feelings that we have recorded from our parents or other authority figures during our childhood. It is the taught part of our personality. Critical parent. This side focuses on rules, judgment, and criticism. It is the voice that says, you must do this, or that is wrong. Nurturing parent. This side focuses on care, protection, and support. It is the voice that says, I am here for you, or you're doing a great job. 2. Adult ego state. This state is the thought part of our personality. It is objective, rational, and focuses on the present moment. The adult state processes data, makes decisions based on facts rather than emotions or past experiences, and is not influenced by the rules of the parent or the impulses of the child. It is the part of us that solves problems logically. 3. Child ego state. This state consists of behaviors, thoughts, and feelings that we experienced as a child. It is the felt part of our personality. Natural child. This side is spontaneous, curious, creative, and emotional. It is the part of us that enjoys life and expresses feelings freely. Adapted child. This side is the part of us that learned to adjust or adapt our behavior to please authority figures or survive in our environment. It can manifest as being compliant, rebellious, or overly cautious. Important details. Transactions. Communication between people is called a transaction. If you speak to someone from your adult state and they respond from their adult state, it is a stable, complementary transaction. If you speak from your parent state and the other person responds from their child state, it is also complementary. Problems often arise when transactions are crossed. For example, if you ask a question from your adult state expecting an adult response, but the other person responds from their critical parent state, the communication breaks down or leads to conflict. Shifting states. Healthy individuals are able to shift between these states appropriately. For example, you might need your nurturing parent to comfort a friend, your adult to manage your finances, and your natural child to have fun at a party. Examples. Example 1. The parent state. Imagine someone sees a colleague making a mistake and says, "That is completely unacceptable. You should know better than to do it that way." This is the critical parent state in action, enforcing rules and judging the other person. Example 2. The adult state. A student is preparing for an exam and thinks, "I have 2 hours to study. I will focus on the most difficult chapters first and take a 5-minute break every 30 minutes. This is the adult state, using logic and planning to achieve a goal. Example 3. The child state. A person is at a birthday party and starts laughing, dancing, and trying out a new game with pure excitement. This is the natural child state, expressing spontaneous joy and curiosity without worrying about rules or judgment. Conclusion. Transactional analysis provides a framework for understanding how we communicate and why we sometimes react in ways that feel out of our control. By recognizing which ego state we are, using parent, adult, or child, we can become more aware of our communication patterns. The goal of TA is often to strengthen the adult state, allowing us to interact with others more effectively, resolve conflicts rationally, and live a more balanced life. Wilderness therapy, adventure-based therapy. Definition: wilderness therapy is a type of adventure-based therapy that uses outdoor experiences and activities to promote personal growth, healing, and positive change. It combines elements of nature, adventure, and therapeutic practices to help individuals, especially adolescents, overcome challenges and develop new skills. Key concepts. 1. Nature as a healing environment. The natural environment plays a central role in wilderness therapy. Being outdoors can have calming effects, reduce stress, and promote a sense of well-being. Nature provides a unique backdrop for self-discovery and personal reflection. 2. Adventure activities. Wilderness therapy often involves adventure activities such as hiking, rock climbing, canoeing, or backpacking. These activities challenge participants both physically and mentally, helping them develop resilience, teamwork, and problem-solving skills. 3. Therapeutic support. Trained therapists and guides facilitate the wilderness therapy experience. They provide emotional support, help participants set goals, and encourage reflection on their experiences. The therapists use the challenges faced during activities to explore deeper emotional and behavioral issues. 4. Group dynamics. Wilderness therapy typically involves group settings where participants can build relationships, share experiences, and support one another. This group dynamic fosters camaraderie and helps individuals learn from each other. 5. Personal growth and skills development. Participants in wilderness therapy often gain valuable life skills, such as leadership, communication, and self-awareness. They learn to work through their emotions and face fears while developing a stronger sense of self and confidence. Important details. Target population. Wilderness therapy is often aimed at adolescents and young adults who may be struggling with behavioral issues, mental health challenges, substance abuse, or difficulties in social situations. It can be an effective alternative or complement to traditional therapy. Structure of programs. Wilderness therapy programs typically last from a few days to several weeks. They often have a structured schedule, including daily activities, group discussions, and individual reflection time. Participants may also engage in skills training related to survival, teamwork, and self-care. Safety considerations. Safety is a top priority in wilderness therapy. Programs are designed to ensure that participants are physically safe while also providing emotional support. Trained staff members manage risks associated with outdoor activities. Examples. Example 1. Hiking and reflection. A group of teenagers goes on a multi-day hiking trip through a national park. During the hike, they face challenges such as steep trails and adverse weather. After each day, they gather around a campfire to discuss their feelings and experiences, reflecting on what they learned about themselves and each other. Example 2. Team building through rock climbing. Participants work together to complete a rock climbing course. As they encourage each other to reach the top, they develop trust and teamwork skills. Afterward, the therapist leads a discussion about overcoming fears and supporting friends in challenging situations. Example 3. Canoeing and problem solving. A group is tasked with navigating a river while canoeing. They encounter obstacles and must work together to find solutions, such as how to steer around rocks or manage strong currents. This activity teaches them to communicate effectively and adapt to changing circumstances. Conclusion. Wilderness therapy, or adventure-based therapy, is an innovative approach that uses the outdoors to promote healing and personal development. By engaging in adventure activities, participants learn valuable life skills, build relationships, and gain insights into themselves. The combination of nature, adventure, and therapeutic support creates a unique and impactful environment for growth and change, making it a powerful option for those facing personal challenges. Wilderness therapy, boot camp model. Definition. The boot camp model in wilderness therapy refers to a structured program that uses military-style discipline and rigorous outdoor activities to instill discipline, responsibility, and personal growth in participants, often adolescents or young adults. While the aim is to help individuals overcome behavioral issues and develop life skills, this approach has faced significant criticism. Key concepts. 1. Military-like structure. Programs using the boot camp model often mimic military training. They include strict rules, a hierarchical structure, and a focus on obedience and discipline. Participants may engage in physical training, drills, and group tasks, similar to what one might experience in a military setting. 2. Intensive environment. The boot camp model creates an intense environment where participants are pushed to their physical and emotional limits. The idea is that through these challenges, individuals will learn resilience and improve their behavior. 3. Focus on compliance. The emphasis is often on compliance with authority figures and adherence to rules. Participants may face consequences for disobedience or failure to meet expectations, which can include physical challenges or loss of privileges. Important details. Criticism of the boot camp model. Lack of therapeutic support. Critics argue that the boot camp model often lacks adequate therapeutic support. While physical challenges can be beneficial, they may not address the underlying emotional or psychological issues that participants are facing. Effective therapy usually requires understanding, empathy, and emotional processing, which might be overshadowed by the military-style approach. Potential for trauma. The rigid and punitive nature of boot camps can lead to increased stress and trauma for some participants. Instead of feeling supported, individuals might feel punished or humiliated, which can exacerbate existing mental health issues. Limited long-term effectiveness. Research has shown that programs focused primarily on discipline and compliance may not lead to lasting behavioral change. Without addressing the root causes of a participant's challenges, any improvements may be temporary. Alternative approaches. Many professionals advocate for wilderness therapy models that emphasize personal growth through positive experiences, teamwork, and emotional support rather than strict discipline. These programs focus on collaboration, self-discovery, and healthy relationships, which are often more effective for long-term change. Examples. Example 1. Boot camp experience. A young person enters a boot camp-style wilderness program and is immediately subjected to strict rules and physical challenges. They may be required to wake up at dawn, complete demanding exercises, and follow orders from leaders without question. While some participants may initially respond to this structure, others might feel overwhelmed or resistant, leading to conflict and frustration. Example 2. Emotional impact. A participant who struggles with anxiety may find that the boot camp environment increases their stress levels instead of helping them learn coping skills. Instead of feeling supported, they might feel more isolated and fearful, which can hinder their ability to engage in the program positively. Example 3. Comparison with supportive wilderness therapy. In contrast, a supportive wilderness therapy program might involve group hiking and discussions around campfires, where participants are encouraged to share their feelings and support one another. This approach fosters a sense of community and understanding, helping participants develop trust and emotional resilience. Conclusion. The boot camp model in wilderness therapy emphasizes discipline and military-style training to address behavioral issues. However, it has faced criticism for its lack of therapeutic support, potential to cause trauma, and limited long-term effectiveness. Many experts advocate for more supportive and collaborative wilderness therapy approaches that focus on personal growth, emotional processing, and building healthy relationships. Understanding these differences can help individuals and families make informed choices about the best therapeutic options for their needs. Wilderness therapy, regulations, and abuse concerns. Definition: wilderness therapy is a form of treatment that uses outdoor experiences to help individuals, especially young people, overcome emotional and behavioral challenges. While it can be very beneficial, there are important regulations and concerns about potential abuse within these programs. Key concepts. 1. Regulations. Regulations are rules and standards set by government agencies or organizations to ensure the safety and effectiveness of wilderness therapy programs. These regulations can vary significantly from one state or country to another. 2. Accreditation. Many wilderness therapy programs seek accreditation from professional organizations. Accreditation means that the program meets certain quality standards and follows ethical practices. This can help parents and participants feel more confident about the program's legitimacy. 3. Licensing. Therapists and staff members in wilderness therapy programs may need specific licenses or certifications to practice. This ensures that they have the necessary training and qualifications to provide appropriate care and guidance to participants. Important details. Concerns about abuse. Physical and emotional abuse. There have been reports of abuse in some wilderness therapy programs where participants are subjected to harsh treatment, humiliation, or physical punishment. Such experiences can lead to trauma rather than healing. Some wilderness therapy programs operate with minimal oversight or regulation. This can lead to situations where untrained staff may not know how to handle crises or may use inappropriate methods to control participants. High-pressure environments. Programs that focus on strict discipline or military-style training can create high-pressure situations that might lead to abusive practices. Participants may feel threatened or coerced rather than supported, which can be harmful to their mental health. Informed consent. It is essential for participants and their families to understand what a wilderness therapy program entails before enrolling. This includes knowing the methods used, the qualifications of the staff, and the potential risks involved. Informed consent means that participants agree to the program with a full understanding of what it involves. Examples. Example 1. Positive regulation. A wilderness therapy program that is accredited by a recognized organization may have strict guidelines about staff training, participant safety, and ethical treatment. This program might regularly undergo evaluations to ensure it meets high standards, providing a safer environment for participants. Example 2. Abuse case. In some cases, news reports have emerged about specific wilderness therapy programs where participants were subjected to physical punishment or emotional manipulation. For instance, a participant might be forced to engage in exhausting physical activities as a form of punishment, leading to physical injuries and emotional distress. Example 3. Importance of informed consent. Before sending their child to a wilderness therapy program, parents should ask questions about the program's approach, the qualifications of the staff, and how they handle emergencies. They should also seek reviews from other families who have participated in the program to make informed decisions. Conclusion. Wilderness therapy can provide valuable support and healing for individuals facing emotional and behavioral challenges. However, concerns about regulations and potential abuse highlight the need for oversight, accreditation, and informed consent. By understanding these issues, participants and their families can make better informed choices and seek out programs that prioritize safety, ethical treatment, and effective therapeutic practices. Ensuring that wilderness therapy programs adhere to regulations can help protect participants and promote positive outcomes in their healing journeys.